Hello, bonjour, kwai, ani, tanshi, ulakut. Welcome to the Canadian Science Policy Conference. We're joining you today from the traditional ancestral territory of the Anishinabeg. My name is Cara Tannenbaum. I'm the Departmental Science Advisor for Health Canada, and I am very fortunate to be joined today by Dr. Harpreet Kochhar. Thank you for making the time to meet me today.
It's my pleasure, Cara.
Harpreet, you have had an exciting year. In January 2021, the Clerk of the Privy Council appointed you as the Deputy Minister Champion for the Federal Science and Technology Community. Before that, you were Associate Deputy Minister of Health until this past October, when you were named the new President of the Public Health Agency of Canada.
That's right, say exact.
Wow. Well, I'm sure that when you were 5 years old and your parents asked you, so Harpreet, what do you want to be when you grow up? These roles did not roll off your tongue. Haha. But allow me to thank you on behalf of the Canadian Science Policy Conference for your contributions. Today, I think all of us want to focus on unpacking your role and your priorities as Deputy Minister Champion of the Federal Science and Technology Community.
Certainly, I'm ready for that.
Mais pour commencer, pouvez-vous nous parler un peu de vous? Qui êtes-vous?
Alors, bienvenue. Je suis vétérinaire de formation. Après avoir obtenu mon diplôme, j'ai travaillé en pratique privée et enseigné à l'université. I, as a veterinarian, joined the Federal Public Service in 2002. And have since held a number of executive positions, including at the Canadian Food Inspection Agency, at the Immigration, Refugees and Citizenship Canada, and as you mentioned, Health Canada before. En avril 2020, j'ai eu l'honneur d'être nommé sous-ministre délégué à Santé Canada. Et plus récemment, comme vous l'avez mentionné, j'ai été nommé nouveau président de l'Agence de santé publique du Canada.
Eh bien, il semble que vos nombreuses expériences antérieures vous aient préparé à votre rôle actuel de sous-ministre champion.
Je pense que oui.
Bien, bravo. Alors, pour commencer, pouvez-vous nous clarifier exactement c'est quoi ce sous-ministre champion?
La fonction publique fédérale est dirigée par le greffier du conseil privé qui relève du premier ministre. Each department or agency is led by one or more deputy ministers who report to the clerk. Clerk appoints deputy ministers to different roles and champion roles. A champion of number of government-wide initiatives, programs, or functional communities. One of them is the science and technology community. And I was given this honor of being appointed as a champion for the DM community on science and technology earlier this year. And as champion, my role is intended to raise the profile of this community and to generate awareness of specific issues amongst colleagues and the public service as a whole.
C'est très clair. Merci beaucoup. Let's go back a minute. So when you say specific issues, I suppose there's quite a lot of specific science issues that are of interest for the science and technology community.
Indeed, there are.
So how do you choose which ones to focus on? How do you prioritize? You have me on the edge of my seat here. Tell us a little bit about what you have in mind.
Well, to begin with, I have coordinated a table of deputy ministers from departments and agencies with a science and technology focus. And together, we've identified a number of priorities. We plan to leverage opportunities to advance science and promote them within science and technology community across the federal public service. For example, through to the employee-run networks or attending events such as these. Our three key priorities, if I may, are science security, intramural science, and acting against racism in science.
Ooh, I like those. So science security, intramural science, which is the value of government science, and acting against racism in science. Can you walk us through them one by one?
Oui, bien sûr. So the first one is science security. Science is built on collaboration, and we are committed to open government, open science, and scientific integrity. Open science collaboration and science security support each other.
Yeah, absolutely. I mean, I come from academia, and I can attest that this issue has been gaining attention in universities as well. Both the needs for open science, for team science, for data sharing, as well as the recent cyber attacks some universities have experienced. So I definitely hear you on that one.
That's right. There's a lot of scientific activity outside of federal public service, including in universities and in the industry. Of course, as civil servants, our focus is on federal scientific activities, and we call that intramural science, the second priority that we are focused on. And as champion for the community, and with other great deputy ministers, leaders by my side, I think we can make strides in demonstrating the strengths of intramural science and the wide range of amazing work that is done federally. I think this has been put out on display over the course of the pandemic, but intramural science strength can be found in more than just the health field.
Absolutely. Let's give a shout out for our government scientists listening, whether they're regulatory scientists, social scientists, basic scientists, epidemiologists, field scientists. I'm really happy to hear that we'll be celebrating our government scientists. All right, so that was two down. Quelle était la troisième priorité?
Well, the third one is acting against racism in science.
C'est vraiment important. Pouvez-vous nous expliquer ce que vous entendez par là?
Bien sûr. Depuis 2020, les ministres et organismes du gouvernement du Canada ont renouvelé leur engagement visant à éradiquer le racisme et en milieu de travail. There has been much talk about negative effects that racism has on employees as individuals. This area, the third priority, is clearly linked as well to the clerk's call to action on anti-racism, equity, and inclusion in the federal public service. But there's also needs to be more discussions about how racial biases can affect the science we do, consciously or not.
Oh, that's a really interesting focus. How racial biases affect the science that we do. Can you give us a concrete example of that?
Well, sometimes the terms we use in health sciences, for example, put an undue focus on race rather than on biological or other factors. For example, when I was in Health Canada, we had internal discussions on the appropriateness of statement made on one of our public-facing web pages. The page listed skin color as a factor affecting vitamin D absorption, with the note that people with darker skin absorb less of sun's ultraviolet rays. While the statement, while sounding clear, is actually quite imprecise and does not really provide guidance in a way that the healthcare providers and patients can use to make informed decisions. So consequently, instead of skin color, the factor was reworded to focus on the amount of melanin, or what is called the natural pigmentation that makes your skin darker. This changed the focus from a societally created differentiator to a factor that was measurable, not content specific, and rooted in scientific analysis. And the explanatory note now reads, it takes longer for the people with more melanin to make vitamin D from the sun's ultraviolet rays.
That's a really good example. I mean, let me just state clearly that race is a social construct grounded kind of in power and privilege from, colonial ancestry. But it's interesting because that socially or self-described membership is often based on physical characteristics. So it's good that we're focusing on the skin melanin rather than skin color, which doesn't put blame on the people. And you're right, we did discuss this at Health Canada. We really focused on what we called anti-racism in science, and there's a commitment to make an action plan around this. And I'm reminded of another example, if I may. I'm a physician, and I worked with COVID patients, especially at the beginning of the pandemic during the long-term care outbreaks. And we were using oxygen pulsimeters, medical devices, to measure oxygen in the skin, because based on your amount of oxygen, if it was 98%, you were fine. But if you were down to 92, 91%, then that was a reason, maybe if you weren't tolerating the oxygen mask, to send you to the ICU and get intubated. And we know that the melanin in the skin absorbs some of those infrared light beams. That's the way the medical device works, and overestimates the amount of oxygen, so that it could lead to biased decisions and inappropriate decisions about, oh, this person is fine, but actually they're not. So at Health Canada, I think we're really looking at, when we get submissions about the safety of medical devices, were they tested across a range of different characteristics, including scientific factors like confounders, the science of how the machine works, and then how that leads to racial biases in the work that we do.
Exactly. It is not about disregarding race in our science. Our science needs to be rooted in the facts, but interpreted and communicated with an understanding of societal realities that may affect how our findings and advice are understood and applied. And that contextualization may shift as the situation evolves, such as during the pandemic, as a DM community with acting against racism in science as a priority. We can help to support the government of Canada's science culture to entrench and reinforce this approach.
Well, I agree. And I love that we're committed to redefining scientific excellence through an inclusiveness perspective. I might also add that, like to think about Indigenous science. What I've come to realize, based on my white privilege and upbringing, is that most of the science that I learned was in university from a very sort of Western reductionist perspective. And there are many ways to acquire knowledge in science. For instance, Indigenous science is passed on through the ages, and it's based on experiential and observational lived experience with nature, and finding the truth about our natural world that way. So, everyone has different interests. Thanks for championing this. Now I think we all understand what a champion is. Thanks for championing this for us. But I know you to be a very wise, curious, informed, knowledgeable, brilliant scientist, Harpreet. You must have other scientific topics of interest, don't you?
Well, I do. All those words of appreciations are very much appreciated. But one topic I must say is very dear to my heart is the concept of One Health. And that has been gaining increasing attention recently. Simply put, One Health is an approach that recognizes that health of people is connected to the health of our shared environment, including animals. Examples of One Health challenge include the emergence of new diseases such as COVID-19 and the decreased effectiveness of antibiotics, which is undermining modern medicine as we know it. As the world's global population continues to increase, agricultural practices intensify, land use practices shift, and our climate changes, we must improve our understanding of interconnections so that we are better equipped to mitigate and prevent unintended consequences. This will require a collaborative, multidisciplinary approach with engagement at local, regional, national, and global levels. And I am totally seized with that concept of bringing up the One Health concept.
One Health, un monde, une santé. And I applaud your foresight because a lot of people say that antimicrobial resistance or the emergence of superbugs is the next health emergency that we're going to be facing. But you're right in identifying that this is what we call a wicked problem in science because it is transdisciplinary, interdisciplinary, interdepartmental, truly global in nature. So I love that you focused on coordination, and coordination makes sense, but it is no simple undertaking.
Oh, agreed. Coordination is challenging and requires leadership, governance, and establishing and setting priorities. There are a number of One Health success stories, I must say, both within Canada and internationally that can be used as examples to guide the governance of future One Health initiatives. Par exemple, le lancement du programme de lutte contre les contaminants dans le Nord dans les années 1990 et 1990 s'est appuyé sur les principes de l'initiative Un Monde, Une Santé. This program focused on reduction or elimination of contaminants in traditional foods and is an excellent example of how the federal and territorial governments, Indigenous communities, and organizations can work together to protect the health of Indigenous communities. Well, another example is the Federal Action Plan on Antimicrobial Resistance, or AMR, and its use in Canada. You mentioned that. And common infections and injuries that were once easily treatable are becoming more dangerous and once again life-threatening. AMR, or antimicrobial resistance, occurs when the bacteria that causes infections adapt and change over time, developing the ability to resist the drugs designed to kill them. While the use of these antibiotics is necessary in certain situations, the overuse of these life-saving drugs in both human as well as animals is speeding up this threat. So if we are left without effective antibiotics, routine medical interventions such as surgeries, what you call hip replacement or other surgeries, chemotherapy for cancer, and even treatments for common illness could become very high risk and too dangerous to undertake. And I must say, AMR could undo decades of worth of medical progress, causing a return to pre-antibiotic era in which common infections could once again become incurable, which would have grave consequence to the health of Canadians and populations worldwide. I'm excited about the work being done in this area and what the future holds in terms of solutions in this regard.
Well, I'm confident, Harpreet, that you will be up to the challenge. Science got us through and beyond the pandemic, and I am confident, as is everyone in the audience, that science will get us through our next health crisis, this time proactively, we're sure. I think that brings us to the close of our interview. It's been fascinating hearing about your priorities, the issues that you'll be leading with your fellow deputy ministers as the deputy minister champion for the federal science and technology community. Thank you so much for taking time out of your busy schedule to join us. And on behalf of the Canadian Science Policy Conference, this concludes our conversation for today. Merci et à la prochaine.
Merci, Cara. Thank you very much.
Hello, because